cardiovascular disease. Many women with cardiovascular disease have few, if any, symptoms compared to men. And this is true because we have something called small vessel disease. And if you look at our heart, how does it beat all day? It's something called cardiomyocytes. And they beat all day, every day, all years, right? And how do they keep clean? Well, you have white blood cell called macrophage, and they go in and clean dead cells. So they're the best buddies for your heart. How do I keep them in good shape? I need to exercise. I need to sleep enough. I need to eat nourishing foods. And a lot of people say, well, I eat well, you know, and then when they come to the institute and they see what well really means, it's a different level. It's a different level because it's alive. So, you know, your heart is an amazing machine that constantly needs to be clean. And, you know, they think by 2035 that 45% of people will have cardiovascular disease. Medication walks in, and some people have 3-4 medication for cardiovascular because they also usually go hand in hand with high blood pressure, high cholesterol. So they have these medication, and then they have other things. 90% of these problems could have been prevented. 90% we're muting. 90% of this could have been prevented. And it's constantly a problem when we have it, because women, we might not show in an angiogram and treadmill, we might not show that we have problem because small vessel is different. And there are tests for this. So you have, you need to ask for tests that will help you with that. And you have the venous blood going into the heart, and you have arterial blood going out of the heart. And you need to see the pressure of both sides. That could help you, and you know. Well, so how do we prevent this? Because I think that's what everybody wants to hear. Diet, exercise, sleep, right? But what about happiness? You heard about heartbreak. How can we actually get heart problems from being stressed and being sad and being nervous and being anxious? Absolutely. Because, and we tend to not eat well when we have that anyway. But if you look at how blood travels into an organ, it travels in through capillaries. These are very tiny capillaries. And red blood cells that carries the oxygen and the nourishment to every organ, they are kind of like jelly beans. They can flip, they can fold. And they need to fold when they go through capillaries into an organ so that it can nourish it. So imagine now, if I drink alcohol, alcohol has too much iron, meat, fish, chicken, too much iron. Iron actually pumps up your red blood cells so that they now are too big. That's when we can get problem. So cardiovascular disease is #1 cause of death for women and men, of course, taking over 400,000 lives per year in the US alone. This is more than any other cause of mortality. That's American Heart Association. So it's #1. And you, I can't tell you enough, if you could have prevented it, or if you're in the middle of it. Let's say I'm taking all these meds. I want to change my lifestyle. Take today. Let's start today. Let's start to eat plant-based diet. And I'm going to take you through what that really means. So, but women in the 21st century have become comfortable living with diabetes, high blood pressure, inactivity, giving us a threefold outcome of death and problems. So we have the chance to move and help ourselves. Obesity raises the chance of cardiovascular disease by 64%. Pregnancy and postpartum increase the risk of stroke and heart attacks, and actually 55,000 additional stroke events that suffer compared to men. Imagine that. So pregnancy is a time when we can have a stroke. And one of our friends, their wife just went through this, and it's been so traumatic for the whole family. Of course, you just gave birth, and then a stroke happened right after, and especially postpartum. So what do we do before we even get pregnant? Of course, if we can change our lifestyle. A lot of women, while we're pregnant, they might be eating anything because we don't have that good, especially first trimester. We don't have good appetite, and we kind of eat anything. A lot of women come here while they're pregnant and have an amazing time, an amazing delivery, and healthy child, because they've been eating so well, and even infections that a mother might have could actually come through the placenta into the baby. So our immune system needs to be, although I must say, I want mom and dad to come here before we get pregnant, because dad's epigenetic is huge part. His mood, his medications, his foods, everything goes into via the sperm into the egg, right as it's have this enzyme explosion and life starts. So this beautiful time in our life should not be having stroke or heart attack. Bioidentical hormone therapy. Well, what is bioidentical hormones? It is very similar to your own hormones, but they're made in a laboratory, and they're usually made from natural plant foods. They didn't show any connection of reduction in cardiovascular disease, because what happens is, especially in menopause, we're told that now, because estrogen and progesterone is so powerful in protecting our heart, that now we need to keep taking it. A lot of women were taking Premarin and Provera, the totally synthetic hormones, and ended up with cancers from that. So that was a big deal in the 1990s, the big nurses study, 100,000 nurses that was in this nurses study. That was amazing, and it got women to move over to bioidentical. So it wasn't showing to have any reduction in cardiovascular disease when they were tested, but yes, it can help a woman to get over trauma of having hot flashes, having depression, not being able to sleep, not have any sexual libido. It can help for a time. But if we hang our hat on bioidentical hormones, that's certainly not enough. It's our lifestyle. It's our exercise, it's our sleeping. It's getting into a lifestyle where we help ourselves with that. So bioidentical hormones can be of help for some time. And of course, you need to be tested every 3 months to make sure you have good levels. And a lot of women feel like, because we really don't stop working. We might have been home with the kids. And by the way, motherhood is really not something that America is rewarding big time. It's, we kind of got into this that everybody has to work outside. We do. In the 1970s, I guess 40% of us were home, 20% of us are home now. And thank God for that. But we got into the working since the big crisis in the war in the 1940s. Of course, a lot of us got into the work field, and now it's nearly impossible to be one person breadwinner, and that is enough. So we kind of want to keep ourselves in good shape, and bioidentical hormones came in. I believe that hormones definitely should be made through my lifestyle, and the hot flashes very much is from the foods that we ate, the sugar we eat, the coffee we drink, the alcohol we drink, the meat we eat, and the chocolate and the cheeses, the dairy. I mean, if it doesn't sound too much fun for a lot of people, they're boo me when I say this, but I get rid of that. The hot flashes go. Women tells me all the time, I don't have any more hot flashes. I start to sleep at night.